Hello, Dr. Vicki Peterson here. I wanted to share with you today some research that came out of the American College of Cardiology, so the study of heart disease. And what they found out was that those suffering from celiac disease had twice the risk of coronary artery disease than someone who did not have celiac disease. Now, this is pretty impactful when you realized that heart disease is the #1 killer of Americans, both male and female, and now you have a certain disease, celiac disease, that doubles that risk. So that is really increasing the risk. In the study they looked at, it wasn't just in the elderly, it was in younger patients as well, that this doubling of risk occurred, and they, quite rightly in my opinion, associated it with inflammation. So I don't know if you've heard the correlation between gingivitis or gum disease and increased risk for heart disease, but that's something we've known for a good 7-8 years now. And when that correlation first came out, it was really when more data about inflammation was coming to the fore and was being understood better. And that is that inflammation in the body is really the root cause or the underlying generator of most degenerative diseases that we're trying to avoid. Not just heart disease, but diabetes and cancer. So inflammation is the bad guy. And that inflammation is known to come from infections. So with gingivitis, or inflammation of the gums in the mouth, we're starting to see a correlation where dentists were coming together with cardiologists and really seeing that patients with dental issues and having inflammation and infection in their mouths were at a much higher risk. So that made sense. But what we haven't been appreciating, in my opinion, enough is really looking at how the inflammation of the gut and how that then affects other parts of the body. So was I surprised to hear that heart disease was increased with celiac disease? I wasn't, because we know that that inflammation created in the gut is leaving the gut and having effects on most systems and organs of the body. We know there's a lot of studies associated with celiac disease and much increased risk for hepatitis or problems with the liver. So we know of other organs that are very closely associated as far as increased risk for damage with celiac disease. And it's because of that inflammation. And it really speaks to what we need to do to improve people's health with celiac disease, not only to get them past their own healing of their own gut to make them healthier overall, but to really diminish these other effects, these secondary effects that happen as a result of not handling that inflammation. And there have been studies, and I'm actually going to be talking about one fairly soon, that show a lot of celiacs, even though they're following a gluten-free diet, still have inflammation in the gut. They still have that damage in the gut. Why is that? Because those secondary effects are not being addressed. So once someone is diagnosed with celiac disease, or gluten sensitivity for that matter, we absolutely have to then dig deep and get to those secondary effects that are really keeping that inflammation and keeping that damage going. And I've talked about this a lot, but it certainly bears repeating, especially with this knowledge of doubling your risk for heart disease. So what are these things we need to do? Very commonly are what I like to call hidden infections in the gut. These can be parasites, amoeba, bacteria. There is a lab test that has to be done to isolate exactly what the organism is, but then it's very treatable typically with an antibiotic, but it's specialized to the organism that's found. So that's very key. Also looking for nutritional deficiencies, cross-reactive foods. We've talked about this. So any of these things, if you're not familiar with, you can just kind of look through some of the other videos or go visit my blog on the site healthnowmedical.com and get some more information. And we also look at the probiotic level, the good bacteria level, to see how that's doing. There are also less common things like heavy metal infection or hormonal imbalance, things that are also keeping the inflammation going. But really the big ones are the infections, looking at the probiotic health, looking at cross-reactive foods, other food sensitivities. These will create inflammation as well. Those are kind of the big guys that we want to look at. And I think I mentioned nutritional deficiencies. And then you go in there, you see you have to remove these bad guys and then go in with the healing. And then you've taken that fire down, that inflammation down, and the gut is healing. And the rest of the body is healing too, because that fire isn't leaving the gut. When I say fire, I'm talking about inflammation. It's kind of easy way to think about it, but that fire isn't leaving the gut and then perpetuating the problem and disseminating, distributing the problem throughout the body. So I think we can really heed this warning from this study, but know what to do. Like, we know what to do. It's not this great mystery. I mean, the analysis that these particular researchers came to is, oh, we should be looking at cholesterol levels more often in people with celiac disease. That's not the answer, or at least it's not the sole answer. We know plenty of people who have normal cholesterol levels that have coronary artery disease. So, plus there's good cholesterol, there's bad cholesterol. Topic for another video, but that's not the sole reason. We have to get to the root cause of the inflammation. So if this is you, or if you're concerned about avoiding coronary artery disease, which really all Americans should be, but especially if it's in your family, please feel free to contact me and we can talk about what a good strategy would be to help you. And then if you know anybody in that category, you can certainly refer this to them. So until next time, I wish you very good health.